Now, Nigeria has reaffirmed a commitment to sustaining its HIV response as a strategic health security priority, noting recent international recognition for its domestic resource mobilization model presented at the G20 Health Summit in South Africa. The country's HIV program has achieved 87% status awareness, 97% treatment coverage, and 95% viral suppression, contributing to 46% decline in new infections over the past decade and a national prevalence of 1.4%. Key gains include rising mother-to-child transmission coverage from 35% to 65% and expanding testing and treatment through community and civil society partnerships, though stigma, insecurity, and high pediatric infection rates remain challenges.
Nigeria's HIV response has not faltered. It has not, it has continued to innovate and it has continued to endure. And today we stand here to give you record of some of our achievements, what the challenges are, and what's the way forward. As others have said, we are on our march to attaining the 95, 95, 95. In fact, we have attained 2 out of the 3 goals. We have 87% of those living with HIV already knowing their status. We have about 99% of those that know their status on life-saving treatment, and about 95% of those on treatment have actually achieved viral suppression. Over the last decade, Nigeria has recorded about 46% decline in new HIV infections. Esther, we hear you loud and clear. We still have new infections, unfortunately, and we still have AIDS-related deaths, but we're celebrating the success that, as of today, we have about 1.4% of Nigeria.
Today, the world pauses to reflect on the fight against HIV/AIDS and the lives affected by it. World AIDS Day reminds us of the power of awareness, early testing, and steady access to treatment. Across communities, advocates and health workers continue to push for prevention, support, and dignity for everyone living with HIV. This moment calls us to stand together, challenge stigma, and stay committed to a future where no life is cut short by AIDS. Let's bring in Dr. Adebobola Bashorun, a Federal Director and National Coordinator, National HIV/AIDS, Viral Hepatitis and STIs Control Program, NASCP, in the Ministry of Health. Thank you for joining us.
Good morning.
Good morning. Well, talk us through this morning the current state of HIV prevalence in Nigeria and the demographic that is most affected by this.
Thank you. Once again, good morning. Today, December 1, of course, Happy New Month. The end of the year we're already there. And so we usually mark this day with as the World AIDS Day globally. And as you know, the theme for this year is overcoming disruptions. And for Nigeria, we are focusing more on sustaining the national HIV response, while globally, of course, is to transform the entire AIDS response in the world. So countries usually use this period to, take stock of where they are in terms of their response, in terms of their performance, and what we've been doing on the HIV program since its first official declaration in 1982. And so in Nigeria, right, we've been able to improve from the prevalence, and prevalence simply means the number of people living with HIV in Nigeria, from over 5%, to less than precisely 1.3% as of 2018, and this year too it follows that, and the prevalence is such that has been dropping, and for us as a country is a good sign that the new infection rates has dropped. And in terms of the population that is mostly affected, we have some key populations that are more affected, and these key populations are people that use drugs, people that have sex with men, that's same-sex relationship, then or female sex workers, but among the general population is still relatively within a control level of 1.3% for the ages 15 to 49 years and 1.4% for the ages 15 to 64 years. So as a country, right, the idea is we want to sustain these gains, and currently it's 7% of the 1.9 million Nigerians living with HIV already know their HIV status, and this was achieved through a couple of interventions like client-initiated testing or provider-initiated testing. That is, provider-initiated testing is when the doctor or the nurses say, fine, we'll see it may not be too strong, let's go and do this test. While the client is when you yourself wake up and you say, fine, you want to know your status. So in total, we have it 7%. And out of this, over 96% of those found are on treatment, and also 98% of those on treatment have some viral load suppression. And viral load suppression in this case means they cannot transmit from one person to the other. So the idea is the more you find, the more you put on treatment, and the more you reduce transmission from one group to the other. The other group that is extremely important to us, which Nigeria has made tremendous progress on, is prevention of mother-to-child transmission. Before 2023, we used to have about 40% of the women that are pregnant having access to PMTCT and prevention for children. But last year, 2024 ending, we were able to achieve 67% of all the women tested, and out of this, everyone that's positive, not much actually, but we've been able to find close to 65% of all the pregnant women that are put on their own treatment. So we keep improving yearly to ensure that we go close to 90% by the year 2020 to 2030. So Nigeria is making tremendous progress around that. Then also in children, we've been able to move the treatment in children from 29% to 75% in 2 years. So this is a lot of work that the Federal Ministry of Health has put into this under the leadership of the Coordinating Minister of Health, Social Welfare, and the Honorable Minister of State for Social Welfare. And of course, working with our partner organization, our agency under the Ministry of Health, such as NACA and the NCDC. Thank you.
All right. Well, what would you say are some of the biggest myths that Nigerians still have around HIV/AIDS?
So I won't say we have myths. I think what we currently have, we had myths, like this national program on HIV/AIDS, NASCAP, was set up in 1987 to respond to the face of HIV then. Then there was no treatment. It was more of talks.
I mean the myths that people would still believe, Nigerians, things about HIV that are not true. That
the myths are not true. For example, that's why I wanted to come from the storyline. A lot of myths have been dispelled. No more. Most of those things don't exist. People know HIV exists. People are coming for treatment. So I won't say people still have myths, but maybe what we need to address now is the new generation, maybe the Gen Z generation, those that never knew the history of HIV from 1980 to probably year 2000, right. Those that never knew the messaging, and so they may still believe does this thing really exist, because in the past we used to see them live, see people that have HIV live on the street, and you treat them. But now, because of the treatment availability and you don't really see people falling sick the way you used to see. So most of the new generations, right? When I mean those less than 20 years, less than 25 years, they usually don't see that impact that we saw those days when we're coming or growing up in secondary schools and universities. So the myth now is probably people will be saying, is this thing really still there or is this not there? But in terms of cultural beliefs, we've done a lot of work to increase knowledge awareness on HIV. So the myths are not the way they used to be in the early 80s. So now our focus should be more making the new generation know that this thing existed and it still exists, and we must still tackle it through prevention, and of course taking the right decisions in terms of abstinence, be mutually faithful, and if at all you have to do anything, use protection.
Okay, let me take you back to the theme, which I find very socially relevant, that captures the evolving and emerging threats that has been associated with the HIV/AIDS prevalence, which talked about overcoming disruptions and transforming AIDS response, and calling for sustained political leadership, international cooperation, and human rights. Let's mark the key word there. When we look at the prevalence rate of 1.4%, which has remained static since 2024, is that indicating a shift in the focus of government on HIV/AIDS to other, because we know the country had been faced with several other deadly diseases from the days of coronavirus and Lassa fever and many others. Is there a shift in the priority of federal government on HIV and AIDS?
So, thank you. Overcoming disruption itself is a new terminology that came into the world space, not just HIV space in 2024, and that came because of a couple of pronouncements by our funders, one of them the United States government, where they said they are reducing funds. So because of that, a lot of countries needed to adjust their priorities, reprioritize what they are doing. But in terms of Nigeria's HIV prevalence, let me also say it here that prevalence doesn't mean high burden of diseases. Prevalence is just the number of the old infection plus the new infection amongst the defined population.
Yeah, but you were taking credit for the past declines. But now
yes, I will come to that.
Narrative.
Yeah, I will come to that. So, in terms of prevalence, right, if you've been able to put more people on treatment, they don't die. It's an achievement. It means they will still be in the pool of those that you calculate as prevalence. So, if you have 200 people living with a disease, not malaria, HIV, anything, and at the end of the day, you still maintain the 200 people, nobody died. It's a success story. And so when you calculate your prevalence at that point, you should still be within that same limit. But there's what we call time skewing. In normal life, whether you have HIV, you don't have HIV, you have any disease, at a certain time in your life, you live the cycle of those living. So that is the natural law of selection, where people will definitely live the cycle of those living. But in terms of those with the disease that are still alive, fine, we are keeping them well, keep them strong, and so the prevalence will not fall to zero. It will not fall to, what we focus on is rate of new infection, which has declined to 0.2. Rate of new infection, it used to be as high as 1%. Rate of new infection is what shows the decline in the new infection. But in terms of prevalence, 1.3, 1.4. For us, we are not bothered if the figures remains like that, because you have to keep those that are alive, those that are living with the disease, still alive on treatment. And so that is the interpretation epidemiologically. But in simple language, okay, in the past, well, in 1999, we had about 5.1% prevalence. There was no drugs then. There was nothing. So a lot of people left the cycle and the prevalence dropped. But now we've been able to stabilize it because there's treatment for people living with the virus. They have nothing to worry about. So our hope is with the future generation, maybe the next 20, 30, 40, 50 years, 60 years, when people naturally leave the cycle of those living, the cohort of people living that are alive, then we'll be able to say this is where we are as a country. But the truth is, by 2030, we want to ensure that the rate of new infection is zero for pregnant women, for children, and for any other person that can be categorized as a population. So prevalence decline or prevalence stability is not a concern. Our concern will be when your prevalence as a country is rising. It means more people are definitely getting more infected. Thank you.
All right. What can you tell us about the cost implications for people living with HIV/AIDS, and what one policy decision, if made today, can rapidly accelerate the fight against this disease?
So the cost implication itself is another interesting one that we need to look critically. You know, for many years, we've depended on so many funding from the external donors, but the country under this government has made a lot of innovation in terms of under the sector-wide approach, under the President Initiative for Lockheed Healthcare Value Chain. So most of the materials we need are now going to be produced in country. It makes it cheaper. So in terms of costing, Nigeria will be able to sustain its response by producing some of these things we need in country, number one. Then increasing the domestic funding for HIV. In the past, we have close to 70% that was funded externally, but now, just for HIV alone, we have this increasing for the country. And we should not forget, health has a lot of competing events. For example, you also have to consider immunization, polio. So in terms of the scale of equity and efficiency, I think the domestic funding for Nigeria is getting a great one ahead. Recall that in February, there was $200 million that was, of course, seeded by the federal government into supporting the HIV response. AIDS, TB, malaria as an integrated approach. And for that, I think funding, Nigeria is well prepared, and we'll reduce most of it. It's going to be a titration, reducing foreign dependency into more local production. But I'm talking about
personally, for someone living with HIV personally, in a month, for instance, what would be the cost implication?
So everything about HIV treatment, testing and treatment is free. So let's get that one clearly. But the other part that people may want to do is, if you have HIV and you have other comorbidity, that means probably you are HIV client, you have a liver disease, or you have malaria, or you have hypertension. Some of these things are not directly covered under the HIV package. But the idea is to use an integrated approach, which is sector-wide approach, and integration of services to ensure that if you benefit from this aspect, you can also benefit from that. So in terms of individual cost for HIV as HIV, it is as good as zero for clients.
Okay, you mentioned something about the testing being free. Where can viewers go today for a free and confidential HIV test?
So we've been able, under the Federal Ministry of Health, we've been able to mobilize at least, I use the word at least because it keeps varying, 25,000 facilities across your country, across the local government, that you can walk in for HIV testing services. But out of this, we have 2,000 facilities that are purely dedicated to providing treatment. And most of these 2,000, to make it simple for us, they are the teaching hospitals, they are the general hospitals, or the specialist hospitals in the states. Any state you go to, and you go to a specialist hospital, or you go to a functional general hospital, and all teaching or federal medical centers, you have treatment there. So in total, we have 2,000 facilities that will give you the treatment required for HIV, but we have about 25,000 facilities that can test you for pregnant women for HIV, or test you yourself if you're working as a client for HIV testing.
Are these general hospitals or?
So by analysis, we have about 40,000 facilities in Nigeria. They fall into 3 categories. And the 2 categories are, general hospitals may be secondary facilities. All the tertiary hospitals, which are the teaching hospitals, all provide these services. All the general hospitals in Nigeria, or specialist hospitals, they provide these services. Then some primary health care centers provide these services. So in total, we have about 25,000 that has a mix of full tertiary hospital, teaching and FMC, full general hospital and specialists, then functional PHCs that can also deliver on this.
Okay. The race against the country's race to end this AIDS and HIV/AIDS menace seems to be a race against time. I want to ask if there is a political will, enough mandates and enough resources. I want to focus on the last mandate of this theme. That's the human rights, which covers stigmatization of those living with HIV and AIDS. What have you done in curbing stigmatization of people living with HIV and AIDS? Because that seems to be one of the biggest psychological warfare in this game.
So, quick one, thank you. Human resources, we have human resources, funding and the rest. We just have to prioritize and use them based on availability. But in terms of the timeline you mentioned, that was your starting point. We planned that by 2030, Nigeria should have achieved full epidemic control, which means almost 95% of those living with HIV are found, and 95% of our children and 95% of course are suppressed. Now, in terms of stigma has significantly reduced because a lot of work has gone out by the government agencies and the Federal Ministry of Health. People living with HIV, like I said earlier, that's why a lot of the new generation may not. So you don't see them the way we used to see them those days. For those that are, of course, above 40 years, those days you see people cachexic, wasted, sick, all those things don't appear again. So you don't even have to stigmatize anybody because you don't even know their health status. You don't know their HIV status. But in terms of when they come to health services, health personnel are trained as professionals to provide necessary services and cover things. So in public, in the general space, you don't see people stigmatizing because you can't see HIV on the face. You don't see people falling sick, falling down. So in terms of stigma, it has significantly reduced. We've done a lot of innovations, a lot of advocacy, and a lot of awareness.
Dr. Adebobola Bashorun, the national coordinator of the country's campaign against HIV and AIDS, hepatitis, and other venereal diseases. Thank you so much for joining us. This is indeed an inexhaustive discussion, and I'm sure that we'll be having you frequently to enlighten the country on where the nation stands in the race against HIV and AIDS. That's all we have time for here on Daybreak. I'm Benga Ashiru. It's goodbye from me.
And I'm Constance Ikoku. Thanks for joining us on Daybreak today. Goodbye.
And I'm Yolanda Robert. Please do keep it here on Arise News. The morning show is next. Goodbye.